day?
I'm good.
Good. Let me check your armband. And you are Janelle Williams. Can you state your date of birth for me?
04/13/1999.
All right. Good to meet you. My name is Kim, and I'm going to be assessing your heart and neck vessels and your lungs and your thorax. Is that okay with you?
Yes.
Okay, wonderful. The first thing I'm going to do is I'm going to auscultate your carotid arteries. And I'm going to ask you to hold your breath for me. Okay. Hold your breath. Okay, and what I'm looking for any bruise, and there were no bruise. Now I'm going to palpate your carotid arteries. And the pulses are equally strong, about a +2, no variation in strength. The contour is smooth and rapid on the upstroke and slower and less abrupt on the downstroke, and no loss in elasticity, and there were no thrills. Now, another thing I'm going to do is I'm going to inspect your jugular. Could you turn to the left for me? I'm going to use my pen light. Now, normally you would be able to see the jugular at a 30 to 45 degree angle. You can actually see it better on a supine, but it should not be distended, and yours is not distended. Now I'm going to measure the jugular venous pressure. Measuring to here. And my straight edge. Get my straight edge. Now I'm going to, as you turn to the left for me, I'm going to inspect the upper portion of the jugular with the straight edge, and then I'm going to measure. Now, normal range measurement is like from 1 to 3, and yours is a 3. Now, the next thing I'm going to do is I'm going to inspect the chest wall for any pulsations that I may see. Now, I would expect to see pulsation near the apical pulse. Normally, that's around the 5th intercostal space, which is the midclavicular line. And now, I do not see any pulsation, but I'm now going to palpate, which I'm going to check again, the 5th intercostal space and the midclavicular for the apical pulse, okay? And I do have about a 1 centimeter in size. It is a gentle tapping, and it is brief. Now I'm going to palpate the apex and the sternum border and the base. There's no abnormal vibrations. Now I'm going to auscultate your apical pulse, and I'm also going to do a pulse rate deficit. Okay. Take a listen. I'm going to do this for a full minute, okay?
Okay.
Okay, you have a regular rate and rhythm. You have about if you were about 64 beats per minute, and the pulse deficit. There was no pulse deficit. Okay. Now I'm gonna listen to the areas of the heart. Okay, I'm gonna start the right intercostal space. This is the base of the heart. The second intercostal space on the left side. The third intercostal space. The fourth and the fifth. Now what I'm listening for is any extra heart sounds. Now at the base of the heart is the loudest, and it is the AV valve closing, and at the apex of the heart is where you hear the AV valves closing, and it is the loudest, and that's the S1 sound, and that's the lug sound that you hear. Now the dove sound is the S2 sound, and that's where you hear at the base of the heart, here at your atrium, and that is where it's loudest at S2. So here's your S1 at the apex. That is your ventricle. That's actually where the ventricles are in systole. That's the output of the ventricles. Okay. And I found no other extra sounds. No S3, no S4. Now what I'm going to do is ask you to sit up for me. I'm going to listen again. Now I'm going to ask you to lean forward. Lean forward. Now what I'm listening for are any soft murmurs that can be heard when a patient leans forward. Okay. No. Okay, now I'm going to lay you back, and I'm going to listen to you on the left side. Ask you to turn slightly to your left for me, and I'm going to also take your whole body turn to the left. Okay. Okay, Mr. Williams, now I'm going to assess your thorax and your lungs. Now, I'm going to inspect right now. I'm looking at the posterior thorax. And your scapula is symmetrical. I see no protruding, no bulging. I'm going to put on my gloves. And I'm going to palpate for tenderness and any sensations, okay? And I'm also going to inspect for any masses or lesions. Now, I see that you're relaxed. I don't see you using any accessory muscles. You're using your diaphragm, which is normal. You're sitting up with your hands in your lap. That means you're supporting your weight good. Okay, so tell me if you feel any pain, any tenderness, okay? I see no lesions. I feel no masses, no lumps, which is good. Now I'm going to check for firmness. As I move my hand across, you please say 99.
99. 99. 99.
Very good. Now what I'm going to do next is I'm going to also palpate for chest expansion. What I'm going to do is I'm going to hold my hands to the T7 and T10. What I'm going to ask you to do is take a deep breath, inhale and exhale. Which is good. Your expansion was about 3 to 5 centimeters. Now I'm going to percuss your areas. What I'm doing, I'm checking for tympani, any dullness, resonance, which I hear resonance along the base of the lungs, which is normal. Okay, now Mr. Williams, I'm gonna assess for well, I'm gonna cuss for diaphragmatic excursion. I'm gonna ask you to exhale as much as you can. I'm gonna start at this T7 vertebrae, and when I start to percuss, I want you to put my hand here. I want you to exhale as much as you can, and then hold it. Okay, exhale. Okay, now inhale. Wait a minute. Let me get my marker. Mark this spot. Okay. Now, inhale as much as you can. And hold it. Okay. Now I'm going to mark that spot. Okay. Now I'm going to do the other side. And the same thing. Exhale as much as you can and hold it. Okay. Okay. I'm going to mark that spot. Okay. Now inhale as much as you can and hold it. Okay. Mark that spot. And I'm going to measure those two markings. Now, excursion is between 3 and 5. That's normal. And yours is at a 4, which is good. Now what I'm going to do is I'm going to auscultate for breath sounds. Okay, you just follow my command. Take a deep breath. Okay, and let it go. Okay, again. Okay. Comfortable? Okay. Very good. I hear no adventitious lung sounds, no wheezing. Um, just breathe normal for me. I'm just going to check the rate. You have about 20 breaths per minute, which is normal. And you can turn around now for me. I'm going to now I'm going to also do auscultation for cacophony. I'm going to ask you to do 99, and then echophony, I'm going to ask you to say E, and then whisper pectoralique. I'm going to ask you to whisper 1, 2, 3, okay? $99, $99, $99, okay. E, 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 E. 1, 2, 3. 1, 2, 3. Whisper. Again. Again. Okay, very good. The voice transmission is soft, muffled, and indistinct. Now what I'm going to do is assess your anterior thorax. Now I'm going to inspect the shape, inspect the position of the sternum. It's midline and straight. Thank you. The anterior posterior diameter is less than the transverse diameter. And the ratio is about 1 to 2. Now I'm going to inspect the slope of your anterior and lateral viewpoint. I'm going to inspect the slope of your ribs and anterior and lateral viewpoint. Can you sit up straight for me? Now it's symmetric. The intercostal spaces or coastal angle is within 90 degrees. Now I'm going to inspect the quality and pattern in respirations. Okay. Okay, you're breathing about a 16. It's regular rate. The rhythm is relaxed, and and the rate is about, yeah, I told you about 16. Um, Now I'm going to inspect the intercostal spaces. There, you're not using any accessory muscles to breathe. I'm going to palpate now for tenderness, and let me know if you feel any pain. No pain. I feel no lumps. I see no lesions. I see no masses. Now what I'm going to do now is I'm going to palpate for the expansion. Okay, I'm going to put my thumb here, and I'm going to ask you to take a deep breath in and out. Okay, very good. Now, thumbs did move outwardly and symmetric from the midline. Now, I'm going to percuss for tone above the clavicle and then your intercostal spaces. Okay, I'm going to check for resonance. Now, I should hear resonance over the lungs, but over the breast tissue and the heart, I'm going to hear dullness and tympani as I get to the stomach, and flatness over the bone, okay? That's flatness. You hear this different sound? Very good. Now what I'm going to do now is I'm going to auscultate for breath sounds. Take a deep breath. Okay, your breathing is even and unlabored. I heard no adventitious lung sound. Okay, thank you, Mr. Williams. It was a pleasure meeting you, and I hope to be seeing you again.